So it's a no-brainer. Everybody who's serious about stroke care or heart attack care should be using Get With The Guidelines. It will absolutely improve your hospital's ability to deliver the best care available and give you the tools that you need to look critically at your system to find out why you're not achieving your goals on a day in and day out basis. The American Heart Association and its Get With The Guideline programs are now starting to expand beyond the walls of the hospitals and really taking a look at what we can do to improve systems of care. So, as is typical, our hospital thought for a long time that it was doing a really good job taking care of people. So when it came time to look at how we were doing taking care of stroke patients, we realized that we didn't really have any hardcore information to help us make better treatment decisions. So we decided that it would be useful to use a national database system to gather information so that we could measure the quality of the care that we were delivering. And the obvious choice from the beginning was the Get With The Guidelines program from the American Heart Association. Get With The Guidelines was born and bred by physicians and other providers who understand what it means to deliver excellence in care. The information that we gather using Get With The Guidelines has genuine clinical meaning and allows us to look critically at our program and make good decisions about how we can do things better. Well, really the changes have been amazing. So from the beginning, what we started doing is raising the awareness of what stroke looks like and also beginning to help people understand that it really is an emergency and that time is brain. So that gave us the tools that we needed to start looking at how our hospital functions and figure out what the barriers were that were making it hard to treat people quickly in a time-sensitive manner. Well, Target Stroke was developed in order to encourage hospitals to really start looking at how they could treat patients more quickly, because there's a huge body of evidence that gets bigger all the time that tells us that the faster we get clotbuster into our patients, the more likely they are to have a good outcome. And it turns out that that's the hardest part about setting up a system of care, is making it go quickly, because every single case presents its own unique set of problems. So Target Stroke gave us the incentive to bulldoze all those barriers and get the patient taken care of first and worry about other little problems later. So when we first started taking care of stroke patients, we were lucky to see a patient eligible for clotbuster more than once a month, and our ability to treat them wasn't very good. So altogether, we probably treated 5 or 6 patients in the first year of the program. That might have increased by a couple patients per year over the first few years. But once the program really started settling in, we started seeing our numbers almost doubling year by year, so that we were treating a patient every month, a patient every 2 weeks. We're now treating 1 or 2 patients every week, sometimes 3 or 4 in a single day. And we're able to do this time in and time out in a much faster manner than we used to be able to. So when we first started, again, we were lucky if we saw the patient at all, and if everything went perfectly, we could usually get them treated within an hour and a half. These days, we're not happy if we're not looking at 20 to 30 minutes as the treatment window. So we've had several patients already in the past couple of months who've come in with what would be devastating strokes, not seeming to get better with TPA, but when we go in there and pull the clot out using the stent retriever, I have literally watched patients completely resolve their stroke symptoms laying on the angiogram table and being able to walk out of the hospital a day or 2 later with no stroke symptoms whatsoever. This is a new era in stroke care that is tremendously exciting, but raises the bar in terms of our responsibility to make this care available to everybody in our society.